Now, let's focus on this one. 3 years. That is how long it could take South Africa to manufacture a COVID-19 vaccine from scratch. The Science and Technology Department says even though the country does have the capacity and expertise, the process will take time and a lot of work. The department's Deputy Director General, Mmboneni Muofhe, is joining me now to discuss this further. Mmboneni, good afternoon. Welcome, DDG, to the Midday View here on ENCA. I guess it takes time, as we all know, to produce vaccines. What will be the biggest stumbling block to South Africa? We have the expertise, we have the capacity.
Yeah, thanks very much, Dan, and also good afternoon to all the viewers of this particular program in ENCA. So there are a number of things that we need to consider. Firstly is the issue of manufacturing, and if you want to really bring it into easier language, is you really need to have the necessary stoves and the pods to manufacture. And the bulk of that, we do have some existing capabilities. You may probably be aware of the fact that we are one of the countries through Aspen that will be manufacturing J&J vaccines. We also have BioVac, under which we're having some discussions and negotiations on which vaccines can we potentially manufacture locally. Now, we're just wanting to really say that there needs to be an appreciation of the fact that it's a little bit of a complicated process, so you cannot just wake up and manufacture tomorrow. And I'll give an example. We all know that some of the problems that J&J ran into in the States was when one of the contract manufacturers actually had problems in their manufacturing facilities and resulting in over 15 million doses being spoiled. Now, what we're saying is that you're going to need to have that tech transfer arrangement and you go through that process where if you don't have glitches, it's fine, things can be much easier. But in most cases, you probably will have glitches where you need to go back and correct and recorrect. So that's why we're saying people mustn't just think that because we are talking about manufacturing that you just wake up tomorrow you manufacturing.
Okay, so I guess it's a complex process. We understand that. 3 years will be the time frame. A few months ago, I interviewed a scientist here on the Midday View on ENCA. One other aspect they were mentioning was budget, money. To manufacture a vaccine would require a lot of funding. I wonder where government would get that money, or you would rely then on a partnership with the private sector?
So we cannot, as government, do this thing alone. There are a number of things that we're looking at doing. One of them is to create the platform for manufacturing to happen. There are a number of proposals that we have as we're working towards this work of vaccine development. One is already there is money that has been availed to build some facilities in BioVac, and that work is now in progress, and that was really done very quickly. So soon we would have upgraded facilities that are ready at BioVac in Cape Town. Now, when that is done, and that has been now so far with the investment of government funding. However, we are also engaging a number of private sector players. These are companies, you might have read some of the breaking news already a couple of weeks ago about some interested investors. So you then have to bring those as the partners in the process. But as government, having made sure that all the regulatory processes don't actually become a stumbling block to the process. So we have already started doing some work, and you know, we hope that it is not going to take 3 years. We hope it's going to take less, and it could take less, but we just want to really emphasize that it's not something that you can predict. Otherwise, everybody will be doing it. Today, we're sitting with a global demand of vaccines, which is much higher than the current existing manufacturing capacity.
Yes, and we don't know when the next pandemic will come. And Africa has been found to be on the back foot. President Ramaphosa talking about vaccine nationalism, the World Health Organization as well. So do you think this capacity that you are busy trying to put together, obviously, as you go forward with the private sector, you get the right regulation, you got the right expertise, and you get the right levels of funding, will also enable us to be able to produce other types of vaccines against future viruses. So it's not a capacity we're building just for now. Is it a long-term vision here?
Yeah, it's actually, you just hit the nail on the head. Because, for example, in terms of vaccines development, we know now that we are too late to get into the actual development. Hence, we're now focusing on COVID vaccine manufacturing. However, the plan is now looking at, while we are on the immediate side looking at COVID vaccine manufacturing, what can we do now in the long term so that we don't get found wanting? You know, I always say that the one thing that we need to know is that when you respond when the pandemic is here, you don't need to be looking at establishing capability, but looking at upscaling. So that is really what we are preparing ourselves to say. When the next pandemic hits, we want South Africa and the African continent to be ready. And that is why we're working on it. So in response to the president's request, our final submission will include what we are doing in terms of COVID vaccine manufacturing, what we are doing in terms of the long-term and preparedness for the next pandemic is going to be like. And as I said, we have already started putting together the puzzles of this particular problem, and we are getting ourselves ready for the next pandemic while we are responding to the current.
Okay, good luck with it. Hopefully it takes less than 3 years, as you hope, Mr. Muofhe, and we'll keep track of this development. Thank you very much for your time at this hour. That's the Deputy Director General, Mmboneni Muofhe, from the Science and Technology Department. It could take less than 3 years for the country to produce its own vaccines, manufacturing first, but they're also having a long-term vision, because who knows when the next pandemic will hit us. And this time around, Africa was found very much on the back foot of vaccines.